nice. Okay, good. So please please interrupt me whenever you have any questions. This is meant to be a conversation. Okay. So I don't have any disclosures, and I want to make a comparison to starting intern year with a video game. And this is probably one of the hardest video games you will ever play. And the reason why I wanted to do this is it's because I believe there are many similarities between those two, and I think it can make it a little bit less scary if we think about it in this way, this fun way. So essentially, what we're gonna go over is some focus areas that we're gonna go through the whole presentation. But I want you guys to keep your mind open, and I want you guys to, you know, don't stay just thinking about the content, but also about how you feel inside and how you see yourself starting to this new role soon in July or in future years, if that's the case. So these are essentially the things we're gonna discuss. As I told you last time, for me, it's important always to know the game. So you need to know what you are getting into. So we're gonna go over that. We're gonna go over the mission, the team, tutorial level, surpassing expectations, providing and receiving good feedback, and also we're going to have a practical framework of how to go over all of these that we have discussed. So essentially, know the game. This is where I want to take a little bit of time. So residency is a long journey, and it's not only long in terms of time, in terms of years, but also in terms of the more effort you put into it, that you feel like the days are longer. Now, that's the way I felt it, at least. Of course, people have different perceptions, but every day feels longer. But when you close your eyes and open your eyes, boom, a month is gone. So I think like it's a weird time perception where each day, individual day is longer, but then time in talking about medium term, residency is gone. So I'm finishing residency this month, and it's unbelievable to me that time flew by so fast. And it's definitely not a sprint. Residency is for sure a marathon. What do I mean by that? Eh, it's important to keep in mind that you have seen the Olympics, right? So in the Olympics you have the different categories, and you have seen Usain Bolt running as fast as possible, breaking all the records, but he cannot keep that same pace throughout 20 kilometers marathon. That's impossible. That's a short sprint, and residency is a marathon. So it's important to also know and recognize that you have to auto-regulate yourself in all points view. So, for instance, um, from the energy perspective, you need to be, yes, it's important to start strong, yes, but don't overburden yourself at the beginning to a point where you will be exhausted and drained. And then by the end of the year, you're not going to be able to perform. So it's a marathon. The same applies to the emotional component, because yes, people don't talk about this so much, and I want to mention it now. Residency is an emotional experience as well. And we're gonna go over and some tips and tricks and why I believe that's the case. But essentially, also it also has an emotional toll that is gonna be divided throughout the 3 or 4 years, whatever your residency is, whatever the length of your residency is. So think about that. Don't always think that you are gonna have to deal with whatever you're dealing for more years. So it's important to keep track of that and be mindful of regulating yourself. Now, this is something that I actually, before when I was preparing for this presentation, I asked the current PGY ones in my program, what would you guys have wanted to know before starting? And this was one point that they brought it up, which is it's important that you know that you're going to be evaluated, and you're going to be evaluated from all perspectives. What does that mean? What is the meaning of that? Well, essentially, your residents, your seniors are going to evaluate you, your attendings are going to evaluate you, your even nurses are evaluating you in a way that you don't know. So it's, if you make a mistake, or if you are rude to a nurse or a physical therapist, that may come back to you. So everybody's evaluating you in a sense, and uh, in order for you to progress in residency, what do I mean by that? In order for you to become a PGY-2 by the end of the academic year, you have to meet certain milestones. You have to reach certain evaluation points. You have to be above the minimal requirements. So it's important for you to understand that, because you have to bring your best foot forward. I mean, residency, yes, it is the continuation of medical education after finishing medical school, but at the end of the day, it's also a job. So you have to be professional, and you have to take that responsibility. It is a job. You are getting paid. There are expectations. You sign a contract. So all of this to say that pay attention to how your program is gonna evaluate you, and try to fulfill those milestones. Ask about it if your program has not communicated that to you. Okay. Now, this is super important. Kindergarten skills. I mean, it may sound silly, but it's not. So, basic things like saying good morning, saying how are you doing, saying thank you, appreciate your help whenever you're calling for a consult. All those skills, very, very basic soft skills, are super important for your success, because medicine is a team sport. It is. And in the center of everything is the patient. The patient, the way I talk to my patients, I tell them, uh, now that the MBA is like a very trendy. So I tell them, hey, you are Wemby, and we are the rest of the team. So Wembanyama is the best player in the San Antonio Spurs. So I tell them, you are the most important player in this team. We are here to support you, but you are the most important. You are our captain. So the same way it applies to all the other members of the medical team. And we're going to talk a little bit about that, so I don't want to be ahead of that. Then don't be afraid to ask questions. This is super important. Super important. You are not expected to know everything. Residency programs are not expecting you to start like Sir William Osler. I mean, you guys are starting from scratch. So don't be afraid. This is the moment where you can ask all the questions that you want, and you're gonna get the answers. Okay. Now, as you progress, you have to be putting a little bit more effort to getting those answers on your own. Okay. At the beginning, we're going to talk about it later, but at the beginning, you're going to be focusing more on how to do things. And that then you have to ask questions. But as you are becoming more confident on how the hospital works, then you're going to have to transition a little bit more into, okay, your mind starts to set, and you know how things are done. So then you have to ask yourself, oh, what is the right diagnostic approach for this patient? What is the right therapeutics? Who should I consult? Which ones of all of these problems that the patient has is the most important to tackle first? So uh, sometimes that information, you can find it online. What is the workup for adrenal gland tumor? I mean, you can find it online very easily. Yes, if you want, you can ask your senior and you can ask your attending. But there will be times when you are facing questions that you don't remember, and it's normal. But you can find those answers yourself. So it's you're gonna have to learn how to prioritize. When do I need to step up and call my senior and ask those questions, and when I have enough time to research it myself, and maybe you can confirm later with your senior. Okay, so for instance, if we're talking about a patient that is getting sicker, that is requiring oxygen, is becoming tired, is tachypnic, it's already on high flow nasal cannula. I mean, the patient is deteriorating. You don't have time to actually go to your computer, type open evidence, get into the guidelines of how to manage acute respiratory distress. No, you don't have time at that point. At that point, if the patient's life is on the line and you have hours to minutes, then you have to go ahead and ask for questions from the get-go and go and find people that's gonna have more experience and knowledge, and they will be able to help you. So that critical thinking of determining what do you use, what approach do you use in which situation, it's something you're going to have to learn, and I encourage you to think about it before asking the question. Okay, is my patient going to die in the next 2 hours if my question is not answered? Think about that. If the answer is maybe yes, then you need to go ahead and escalate it. If the answer is no and you have enough time to, because your question may be just about workup, what other lab do I need to get? Do I need the lab right now, or can I wait 2 hours, or can I wait 1 hour? Then you can actually go ahead and do your research. Okay, so that uh, it may not be too evident at the beginning, but a lot of the skills that you're going to develop in residency is critical thinking, and that's one area where I have seen residents struggle a little bit. Critical thinking. So that's basic, and you're going to develop it by doing repetitions. Okay, so and we're going to go over that, but just keep that in the back of your mind. Critical thinking is super important. Okay, so don't be afraid to ask questions. Then clear communication. Uh, yes, we are a team. We have multiple team players, and we have the patient at the center. But if we don't communicate among each other, then the patient and the team is not gonna do well. Okay, so it's important to have clear communication, closed loops. Okay, so if you have to call a consult and I don't know, cardiology, and you are asking cardiology, does this patient need a heart cath? And the question is, and the cardiology fellow tells you, you know what, I'm gonna figure out. We'll let you know later. Okay, good. So if you don't tell that to your team is gonna be thinking that you didn't do it. Your patient maybe not even gonna get prioritized, because if that patient is getting worse and time is going by, you can even escalate. So the attending can call the other attending, hey, what's going on? We need this patient is getting sicker. This patient needs a cath. So be intentional with your communications, and you have to be clear, be very clear. When you ask a question to a consultant, you have to be clear. What is the question? Okay. And I think the most important part of residency is be ready to be adaptable. All right. So these are like general concepts that I want you guys to understand. Then uh, the big question that probably is surrounding your heads right now is, am I ready? And the answer is yes, you are definitely ready. As I told you, you are not expected to be Sir William Osler at the beginning. I mean, you are supposed to know anything, basically. Okay, and every program is different. Every program has different standards and cultures, but you are supposed to be there to learn. So yes, you are ready, and that self-doubt that you feel right now is called imposter syndrome, and it's real. And I actually believe it is a superpower. Why? Because that hesitation in yourself, it's gonna make you check, double check, and triple check your work. It's gonna make you check and triple check what everybody else is doing and making sure that things get done. And that is actually going to improve patient care rather than affecting wrongly your patient. Okay, if you act as an intern in the and you follow the protocols, and you if the patient is getting the treatment that they need, that imposter syndrome is going to help you to actually improve patient care. Okay, so it is a superpower, and you are not alone. Everybody, every single rising PGY-1s have the same self-doubt. So keep that in your mind. Everybody has the same doubt. You are not the only one, okay? And all your years of studying, practicing, going to the hospitals, all of that have paved the way for you to reach this point. So yes, you are ready. Don't doubt that. Don't doubt it. And that self-doubt, use it in your favor. Don't fall into the trap of self-doubting everything and making and having a negative internal conversation with yourself. That's something that I want to focus a little bit. So what about the transition? Well, the transition, this is basically like creating the character, right? So how do you transition from a student to a physician? Well, essentially, you finish medical school on one day, and then the following day you are, wow, I'm a doctor now. I'm introduce myself as Dr. Cuenca. It's a big change, but essentially this new identity that you are taking is actually it's not a magical word. Calling yourself doctor is not a magical word. You already have that. You already have the knowledge. Okay. Now the responsibility is real, and I would like you all to keep that in mind. The responsibility is in many, you can see it in many perspectives and aspects. But for instance, one thing that I would like you all to understand is that you can put orders in whatever medical system that you're going to use. It's whether it's Epic, Cerner, whatever, and those orders are essentially kind of like a license, and a license to make the patient feel better, control symptoms, or improve their overall care. But also, that's kind of like license to kill. So be very vigilant of the decisions that you're making. And if you are not certain about any decision that you're making, any order that you're gonna put, talk to your senior. That's exactly why the system is designed in a way that there's always supervision above you. Okay, so it's normal that you're gonna feel like everybody else knows more than you, or that some people are have a different personality. I am an introvert, and the other interns are extroverts, and I feel like they feel so confident. They have the same doubt. They have the same doubts. Everybody has the same doubts. So don't be fooled by that. And this process of residency is a process that thousands and thousands of doctors have gone through, and is very regulated by the ACGME. So it's a process that works. Okay, so you're gonna go through a process that works. So you are gonna get better. You're gonna develop as a clinician, and you're gonna get there. Okay. Now, what are your missions? Well, this talk is intended for anybody that is studying intern year, not only internal medicine, but try to generalize a little bit. But essentially, the first one is to provide excellent patient care, right? So, what do I mean by that? That means, first of all, making sure that you are recognizing complications that are life-threatening. Second, making sure that you are diagnosing appropriately your patient. And third, that you are actually providing the appropriate care at the right time. So being efficient, because you can have the best note ever. Have the best argument ever in your mind. Like you are thinking, oh, this is causing this is causing that. But if you're putting orders at 5 p.m. afternoon, and the patient has been lying there in the room without any changes in their plan throughout the whole day, you are making this patient a disservice. So that keep also that in your mind, and we're going to talk a little bit about the structure of the day a little later. But providing excellent patient care is not only knowing what to do, but also to do it at the right time. The second mission is to provide compassionate and culturally appropriate care. Uh, this is self-explanatory. I mean, uh, you are going to meet patients probably if you are working in a hospital setting. You're probably going to meet them in one of their worst days of their lives. So you are in a very unique position to help and go navigate this uncertainty of what's happening to me. What am I gonna die? Am I? Do I understand what the treatments are? Uh, is this team a good team for me? Am I in the right place? Am I getting the right treatment? So you are in a very a unique position to calm all those anxieties and to communicate clearly. That's what I say. Communication is clear, not only between your teams, but also with the patient. So, and the other thing is that you have to understand that patients have different cultures, and people from different cultures have different ways of communicating and different ways of dealing with grief, with doubts, with everything in life. So being cognizant that maybe your beliefs and the way that you would take on some of these challenges may not be the same way that some other people do. Okay. So super important. You are gonna be there in the worst days of their lives. And you can actually just by communicating in a compassionate way and being there for them, you're gonna make a huge difference. Huge difference. Mission number three, learn the specialty and build your medical gestalt. Now, what is this? So, learn the specialty, you're going to have multiple ways of doing it. That's you can read whatever material your program is providing. You can also use AI. That's something that we're using a lot recently, more recently. You can do your Q banks for your board preparations. You can also read books if you want, or articles, or run or studies online. So all of this is gonna give you knowledge, 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 knowledge. Uh, but uh, remember what I told you. It's medicine. It's way beyond only knowing. It's also knowing how to apply what I know and when to apply what I know. And that is why medicine is not even considered a science; it's more considered like an art. So. Building that medical gestalt, what is that? That's essentially that internal reasoning of taking the information that you know and apply it to the particular patient that you have. So that's medical gestalt, and that perception of I think that for these situations, I think the most likely diagnosis is this. So I think I'm gonna prioritize this treatment for this patient. That is medical gestalt, and you're gonna learn that by repetition. Okay, uh, medicine is a lot of pattern recognition and repetitions. So you're gonna get that repetition. You're gonna have a lot of opportunities to learn from different patients and different situations. So you're gonna get there. Okay. Then fourth, grow in autonomy and teach learners. So as the year goes by and you are becoming more confident, you are knowing more how to solve some issues in the hospital or whatever the setting it is that you are doing your residency, you are gonna become more autonomous, and that's the goal of residency, right? So by the end of your third year, you are supposed to be autonomous. So you're supposed to be able to practice medicine without supervision. So that's something that you need to um, think about mainly as PGY-2 and PGY-3, but perhaps at the end of your PGY-1 year, I would recommend you to start thinking, okay, if I were alone, how would I treat this? Or try to come up with your own interpretation of everything and try to apply your plan and then talk to your attending. Hey, what do you think about that? So that's going to help you grow in autonomy. And then teaching learners, that's super important. I mean, this whole process and this whole system is built upon the understanding that we all need to teach each other, and this is a vertical integration of learning and teaching. So if your program has medical students rotating with you all, that means that you're going to have the opportunity to teach. So, and even I don't know, it depends on who you talk to, but on which program they are. But sometimes I ask my interns to teach me, and sometimes they know more some topics than me, and they teach me. So you can also be in a position where you're going to teach your senior, and maybe even you're attending, who knows? Okay. So, but you have to keep in mind that teaching is also a key part of residency. And yes, you are there to learn, but also you are there to also pass down that information that you have learned. Good. So there are different settings and structures. So yes, you can have depending on the specialty, it could be like a inpatient heavy, outpatient heavy. Uh, but I recommend you right now to be very familiar with what type of rotations your uh, program has and what's gonna be the main priority in your program. So know what rotations are works, know what rotations are more like admission heavy, and know what is the difference between the different subspecialty consults. Know that, because that's going to help you to prepare mentally, especially I would say for the first month. I would start asking now, hey, how is this rotation? If you have the opportunity to talk to one of the, I don't know, the current interns or the chief residents, ask them, how does this rotation work? Because the more you are prepared, the better you're gonna perform. Okay, so I think that applies to outpatient as well. Now, I want to take a minute to talk about the team structure. This is super important, and you have to understand how the structure is. So, depending on where you are, there may be medical students or not, and the medical students are going to be quote unquote assigned to an intern to work with them. Okay, so you may be in charge of some medical students in your residency in a way that the medical students are gonna report to you. So, but at the same time, you have to report to your senior resident, who has also the responsibility to supervise you. And the senior resident, sometimes depending on the service, you may have a fellow who you're reporting to as well. And then even above them, you have the consultants and also the attendings. So it's important to understand how the structures are. This may not be the structure of every team. So understand how the team is structured in your first rotations, because that's going to help you know who should you ask questions first. So for instance, as an intern, if you don't know if you have a patient with diabetes and you have to start an insulin sliding scale on a patient, and you don't know if you're gonna do level 1 or level 2, you're not supposed to ask that question to the attending. Okay, that's an easy question to answer, and that's something that you can ask your senior. So there's a hierarchy for a reason, and the reason is because your senior as either second year or third year is supposed to be making decisions, medical decisions, because they are the quote unquote leaders of the team. They are supposed to be exposed to a situation where they have to make decisions, and so they can gain that autonomy, and they are supervised by the attendant. So you want to give the senior resident the opportunity to have that thought process and that decision making process, so that they can actually exercise their own autonomy. Okay, so understand how the dynamics work. Sometimes you cannot talk directly to the fellow, sometimes you do. Sometimes the senior resident is autonomous of the intern, and you have more patients, less patients, whatever, but you're autonomous. So maybe you can ask some questions, but you cannot ask all the questions to your senior. So understand how the structure is, because that's going to help you to determine how to mobilize politically and ask questions. Okay. Now, it takes a village to provide excellent patient care. It takes a village for sure. And what I mean by that is that there are multiple services that are allied healthcare teams, and all of them are crucial for the patient's improvement and for the patient to go home. So, first of all, I would like to encourage you respect every single ancillary service. Everybody has a super important role. Second, they are gonna be they're gonna be key allies to your learning as well. So if you are able to have a good relationship, professional relationship with them, you can ask questions, and they know a lot of their own specialty. So you can learn a lot just by being friendly with them and showing them that you care for the patient and that's your priority. And if you ask questions, they're gonna help you out. You're gonna learn a lot. So, and third of all, they're gonna make your life so much easier. They're gonna do even favors for you. Hey, I don't know. For instance, let me give you a concrete example. So one of the things that you are very interested at is making sure that whenever your patient is ready to be discharged, you have to be certain that your patient has a safe discharge. What does that mean? What does that mean? Well, essentially, that the patient is going to go to a place where they can operate and be independent. So, does that mean that this patient that is post op, that had a surgical replacement of the hip, can this patient go home? No, they probably need some physical therapy in order to get better and gain that mobility back. So typically in those situations, your case manager and case worker or your case workers are gonna help you. Social workers are gonna help you to find that um, therapy that they need. So, what I'm trying to say is that if you have a patient that is ready to be discharged, but last minute something changed and they don't want to go to one of the rehab places they had already set up, if the case workers already knows you and understand, and you have a relationship with them, they will prioritize your patient because the patient wants to leave, the patient wants to leave right now, the patient is mad, it wants to go. So it's like, okay, let me call the caseworker. I have the number. I call them directly. So those relationships are going to help you to provide better patient care. Okay, so I cannot stress enough how all of these services are important. And if I have to tell you which ones are the ones that you're going to work more closely with, it's going to be nursing staff for sure. The nurses, they know a lot. I don't know if some of you are international medical graduates. At least in my country, nurses have a little bit of a lesser role compared to here. Nurses here are very knowledgeable, and depending on where you are, they may even know more than you. So um, use the relationship with nurses to your advantage. Um, Ask questions and always be humble with all of them, with everybody. Yes, you are the doctor. You are supposed to be in the center of the team, but you are just starting. You don't have the 10, 15 years of experience that all of them have. So be humble. Be humble. That's the only way you're gonna you know establish a good team dynamics with everybody. Okay, very good. So now, somebody has any questions so far? Nope. All right, excellent. Now, yes, somebody said something. No.
No, I said
Okay.
no, not from me.
Okay, gotcha. I don't know if there is a chat. So just interrupt me if there's a question. I'm not seeing the chat here. So what no one tells you. Okay, what is the hidden curriculum of PGY1? So first of all, we already talked about this. Ask for help. Always ask for help. Uh, Asking for help and recognizing that you are not experienced or knowledgeable enough to solve a problem is actually a strength. Okay, so ask for help. Then organize your day. Okay, so this is something I wanna chat about. So I think most of your, like, perhaps like a 50% of your success as an intern is gonna be to develop a good system, and to develop a system that you can improve upon as the days goes by, and as you are getting more and more used to working in the hospital or wherever it is that you're working. uh, that system is gonna change and evolve, but you have to develop a system. Okay. um, this is what I'm going to tell you a little bit about my system, but you have to develop your own system. And this will apply more to a kind of like a clinical, like a medical type of rotation, okay, in inside of the hospital, like an inpatient rotation. So uh, the way I do it is, for instance, every day, every morning, I open my census, I open my team, and I see all my patients. And then the way I do it, I have, if I'm on Epic, I'm gonna sort the patients based on a tool that I have in my dashboard that is called deterioration index. What is that? That is a automatic score that Epic calculates, and has been validated to determine which patients are getting sicker or which patients are sicker. Okay, this is 100% done by Epic automatically. You don't have to do anything, but you have to put it in your dashboard. So what I'm trying to do is I'm trying to have an order of which patients of my from my list I'm gonna chart check first. I'm gonna make sure. Oh, what happened last night? Did the patient got complicated last night? How's the blood pressure now? Is the patient responding? Is the urine output increasing? So those critical questions I'm asking in my brain, and what I'm trying to do is trying to answer those questions for the patients that need the most urgent, or the most urgent decision making as possible. You know what I mean? So that's how I do it. So then I chart check. Well, how do I chart check? I go first to vital signs. If I know the patient, I go first to vital signs. Okay, is the patient stable? Yeah, it looks stable. Okay, so then, okay, labs. What are new with the labs? Okay, this is something I need to address. This is something I don't need to address right now. Okay, then anything that happened overnight, I go to the handoff. Then any new notes from any of the consultants, any new notes from physical therapy that are recommending me that this patient needs therapy 3 times a week. Is that order? No, yes. And then uh, I do all of that. And then as I am evaluating and reading and going over all the information that I just described, I am formulating a plan in my mind. Okay, so for this patient, what is most important today is to do this. And if I am confident enough that this is gonna not hurt the patient and this is the right decision to make, I'm gonna put the orders right there. Boom. So I know that the patient is treated for that day. Yes, we're gonna round later, but the most simple, or the decisions that I believe that I'm capable enough of making, I'll do it in the morning. Of course, you're gonna be interns. I'm a PGY-3. You're gonna be interns. So in your situation, I would recommend you to do that, to formulate a plan, but always check with your senior. Okay. So then I do this for all my patients, and then I go and see the patients. So I round on them before I round with the attending. So after, when we are rounding with the attending, as we are discussing, I'm trying to put the orders of the extra things that we are deciding at that moment that I didn't do earlier because I was not sure, or because this is something new that the attending brought up. So that way, before noon, all the orders are placed. And if I have to call for a consult, I try to do it as early as possible. So all of that allows me to go to noon conference knowing that all the work is almost done and I need to then work on my notes. So the notes are not are important to kind of help you understand and organize everything in your mind, especially in internal medicine, but they're not going to save any life. And I like writing my notes well, but notes are not going to save any lives. The orders are. The plan and the actions that you take as a clinician are going to help the patient. So the notes are the least important item of the day. Okay, you have to finish them timely, but they are the least important. Okay, then you have your follow-ups, and you can call people if you are waiting for a test from cardiology, a TEE. Hey, is the patient scheduled for tomorrow for the TEE? Okay, yes, great. You do follow-ups later. So that's the system that I use. And I encourage you to build your own system, okay? Then the third tutorial, communicate clearly. I think we have already talked about this. I encourage you to practice patient presentations and also consults. Calling for a consult is a very important skill you're going to develop in residency. And you are going to be the one calling for consults early in the year. So uh, there are a few things that I would like you to have in your mind when you are thinking about this. So whenever you're calling for a consult, you're calling as a fellow, most likely, um, that has probably 30 to 40 patients. Okay, the fellow services are way more busy than the primary team services. Why is that? Because they focus on only one thing. All right, but they have so many things going on. So every minute of their time is valuable, very valuable. So if whenever you call for a consult, you need to know the right structure and you need to provide the right information at the right time in order to help that fellow accept your consult and start working on it. You are gonna have some very mad fellows on the other side of the line if you are not doing things the appropriate way. And I didn't know that, and I made a lot of bad calls, a bad consult, like not in the sense that we didn't need it, but more in the sense that I was all over the place. So practice how to make good consults. Okay, you call, you introduce yourself, you say from which team are you, you mention, hey, I'm calling for this patient, this is a consult for, if I'm calling surgery, this is a consult for acute cholecystitis. Okay, so then that helps the fellow or whoever you're calling put in their mind, okay, I need to focus on acute cholecystitis. Is the patient septic? Do I need to take this patient urgently to the OR or not? Is the patient, oh yeah, has a fever and this and that, but it's not septic, So it's different things. So it's a different protocol and a flow chart that goes into their mind whenever you give them ahead of time what the consult is about. Okay, and then you start to describe the patient's clinical course, but you're going to focus on what that specialist is going to take care of. And then at the end, you finish with the reason for the consult or the question that we have is where this patient needs a cholecystectomy, or can a percutaneous cholecystectomy be enough? Boom, that's it. And they're going to say, okay, we're going to run on the patient and then we'll let you know. And that's it. That's a successful consult. Okay. So, yeah, it's important and practice. It takes practice, and you don't have to be perfect on day one, but I encourage you to practice. Okay. Then survive your first months. It's basically this is basically the same as you're organizing your day and having a system. Okay, at the beginning your days are going to be longer because you are not going to be efficient at doing all these tasks, and even using the medical record, you are not going to know where to find which information. But as you put in those repetitions, as you continue to do this over and over again, you're gonna learn, oh yeah, I remember it's in that tab. Oh, I find the same information organized in a different way on this other tab. And this is better because this also has this extra information that I'm also gonna need. So you're gonna discover that, okay? And this is basically repetition, okay? And you're gonna get there. You're gonna get those reps in, okay? So be patient to yourself. Whenever you are feeling overwhelmed at the beginning, uh, always keep that in mind. This is another rep. This is another rep. This is another rep, and you're gonna get better, okay? So, what does your team expect from you? Well, basically to be a good team player, okay, and that means many things, okay. Communication we already talked about, but also having being proactive. So whenever something's going on and are capable of helping, hey, I can do that. I can take care of that. Or you are rounding and you're going from one bed to the other, so you're crossing the hallway and it's a long hallway, and you just finish rounding on one patient, and that patient needs a consult. So and in that way that you're walking those I don't know, 5 minutes that it takes you to walk from one end to the other, you can call the consultant that you just decided to consult, and you can make the patient care move forward by doing that. So being proactive, it's super important as an intern. Now, this is something that I want you guys to understand really clearly. Take ownership of your patients. Your patients are yours. Those are not the attending's patients. Those are not the residents or those are your patients. That means that their care is in your hands. Okay. So you have to be able to, if you don't know how to solve something, if you don't know what to do, you are in charge of finding the solution. Okay. It's your patient, and the overall care of that patient is in your hands. Okay. So keep that in mind. It will happen that you're going to have to do extra things for your patients. And that's exactly how a good physician has to behave, okay? Because that's what good physicians do, all right? So take ownership of your patients. Always ask for help when you need it. That's also part of being a good team player, and that's something that your team expects you to do. Be professional. This is super important. I already mentioned a little bit about this. Residency is also a job. Okay, so you have to be professional, and within your team, you have to be professional, and with other teams, you have to be even more professional. Okay, so keep that in mind. Always having a positive attitude. Residency is hard. It's very hard. It's very demanding. So it's very important to have positive attitude. Oh, I see some chats. Is it possible you can share this schedule algorithm? It's very useful. Oh, yes, yes, I can do that. What time do you get to the hospital? Okay. Examples of unprofessional behavior. Okay, so what time do I get to the hospital? So that's gonna depend on your specific rotation and your program. So I can speak of my program particularly. So when we are on wards in University Hospital, we start at 6 a.m. That's when our clinical responsibility starts. Um, so technically, you should be able to, whenever you are gonna round, you should have chart check all the patients and should have seen all the patients. So technically, your responsibilities start at 6, but if you need extra time because you feel that you are not efficient enough, maybe you have to reach to get there at 5:30. And that extra half hour would allow you to be ready and prepared for rounds. Because that's another thing. Remember, preparation leads to success. So if you go to rounds not prepared, what do I mean by not prepared? Maybe you saw the patients, but you've run super fast, and you saw your patient, but you didn't ask important questions. Or maybe you saw your patients, but you don't have a plan in your mind of what you're gonna do with all of those patients, and you didn't have enough time to talk to your senior about, oh, what's the plan for this patient for today? You know, Um so that means that you're gonna get to rounds, and the attendant is gonna be like, okay, what's the plan? And you are like, I don't know. That doesn't look good. It could happen, but it doesn't look good. You can have you maybe you are not certain, you have options and you're not certain. And I think there are two options because of this. I think this could be a valuable alternative for the plan, but I have doubts because patient has also these other comorbidities, and that's why this other alternative is also sounds appropriate to me. What do you think? So that's much better than saying, "Oh, I don't know what's the plan." You know. So and that brings me to another point. It's very important to verbalize things. Okay, uh, I would like you guys to be able to verbalize your mental process, and perhaps you're not gonna always be able to do it because time is of the essence. But if the more you do it, the more you are telling the person that is listening, your attending or your senior, that you are thinking about this, that you have this knowledge that you're trying to apply to these patients. Okay, so try to verbalize things. Okay, so yeah, so be there. It's gonna depend on how much time you need, and it's gonna depend on how efficient you are, and it's gonna depend on whether your program wants you to be earlier or not. It depends, but I guess my advice would be try to be as prepared as possible for rounds, and take whatever time you need to do that. There was another question, I think. Let's see. Examples of unprofessional behavior. Okay. So unprofessional behavior would be like going to a patient room and you walk into the room, the nurse is there, and you don't say, "Hey, good morning. I'm John. I'm the resident in an amazing team. I'm taking care of this patient. And can you please get a new blood pressure measurement and a new temperature? This patient has been having fevers overnight, and I want to make sure that this patient is not getting septic." Okay, that's one alternative. A different one would be bursting into the room and looking at the nurse. "Did you repeat the blood pressure?" No, 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 I haven't repeated. "Did you get the temperature?" "This patient may be septic, and you have not done that." I mean, this is basic knowledge. You should be doing this. I shouldn't be asking you this. You should have notified me. You see the difference? You see the difference? So that's unprofessional behavior. Yes, patient care is on the line, but you can get the same information and the same result by communicating differently. You see? So that's one thing. And the same thing will be whenever you're you're working with your senior and you have an idea. "Hey, I wanna consult pulmonology because I think this patient needs a bronchoscopy." And then your senior is like, "You know what? Maybe you're thinking about it because the patient has a lung nodule." And it's like, "Yeah, we could do that, but actually, this patient doesn't need an urgent bronchoscopy with a biopsy. This is something that can be done outpatient." And you are like, "No, but I need to make sure that this patient doesn't have cancer. I promise the patient that I want to make sure that they don't have cancer." So, and then your senior is like, "Yeah, but this is something that we wouldn't do in patient." And then you're like, "No, I think you are not treating the patient well. I think we cannot forget about this patient and whatever, whatever." You see, you're not listening to what your senior is telling you. You are anchoring on your own beliefs, and you are ignoring the experience that your senior has. So by doing that, you are being unprofessional. because you are not accepting feedback, and you are not acting on that feedback, and you are actually uh, going against the the person in charge, because your senior is in charge of you. So your senior has to make the decision, not you. You know what I mean? So those can be some examples. How many hours a day you usually spend in the first month? That depends on the program as well. It depends. It depends. Sometimes you are there 12 hours, 13 hours, 10 hours. It depends. Also, it depends also on the structure. Sometimes you have to stay late because you're taking consults in the afternoon. Sometimes you can leave a little earlier. So it varies a lot. How can we handle long days, hours, and not collapse? Well, my best advice would be prepare. So what do I mean by that? Because it is challenging, not that single day. It's the accumulation of multiple weeks of doing this over and over again. So, for instance, if you know you're gonna have long days, and you get home and it turns out that you need to do laundry, you haven't cooked, and you want to eat something homemade, and I don't know, you have to fix your house, whatever, clean your house. So those are extra things that you need to do, and you didn't do them before, and you are now on your long day, and you get home exhausted, and you have to do all of these things to live. So it's a mess. It can become a mess. And preparing ahead and knowing, okay, on the days that I'm leaving earlier, I need to make sure that I do laundry. So in that way, I'm sure that when I'm on long call, I don't have to do that, or I can meal prep if possible, or I whatever. You can find solutions. Okay, and then in addition to that, um, I would encourage you to disconnect as soon as you are done with your shift. As soon as your responsibilities are done, try to disconnect and try to sleep. It is, I think that nowadays it's very easy to fall into the trap of doom scrolling, doom scrolling. Oh yeah, I'm chilling. I'm chilling. I had a bad day. Yeah, but if you are not sleeping your 7 hours or 6 hours, whatever you need to feel refreshed, then you're not chilling. You are screwing yourself up for the future days. So try to maximize the time that you actually rest. And we're gonna talk about that in a minute. How can we have high energy? Well, and the other thing is, of course, caffeine helps. I have mine here. Great. Raul, thank you for this talk. Okay, so Raul, I'm gonna show you my email, and you can email me later. That's something that I like to do because I was in that position before. So please email me later. Um, how to handle step 3 during residency? Oh, that's rough. That's difficult. Um, and it's gonna be basically there are multiple factors. Depends on when your program wants you to take step 3. Some programs tells you, hey, you have to take it in your first 6 months of residency. So you are running against time. So that means I have a framework of how to set goals for yourself, and we can talk about that when we get there. Okay, but the key thing will be to know when you have to take your step 3. Some programs don't care if you take it as a PGY-3. So I think that's the most important thing, knowing when you have to take it. Now, this is something that I have learned, that I have used, that I have applied. And sometimes I'm successful at it, sometimes I'm not. But how to surpass expectations. And this is my own advice. Okay. So first, develop a system to be organized and efficient. And that system, we already talked about, that system needs to evolve with time. Then this is super important. Be up to date with the literature. and know how to apply the literature. What do I mean by this? So uh, there are some big topics in your specialty that you should be very familiar with the literature, especially the guidelines. Okay, so if we're talking about internal medicine, for instance, you should be very familiar with how to treat pneumonia, how to treat diabetes, hypertension. Those are typical things that we see. So if you are up to date with the literature, so you know kind of some recommendations of the guidelines, uh, you can actually excel. And whenever you are presenting a patient or whenever you are discussing a case, you can say, oh, yeah, that's recommended by the guidelines. Or that's a class A recommendation by the guidelines. Um, or there was a recent randomized controlled trial that evaluated this, and then it determined that this treatment is better than that treatment. You know, um, so that's gonna help you look well. But even better than that is knowing when to apply that knowledge. So, and this comes back to what I said about the medical gestalt. Eh, Not always you're gonna be able to apply guidelines to every single patient. Guidelines are not laws, are guidelines, are supposed to help you make decisions, but they're not meant to be fulfilled every single time. Okay, so if you're able to develop this, you're gonna be very well, and people are gonna recognize this very quickly. Then anticipate complications. This is something that I started doing more as PGY-2, but you're gonna start to see patterns in some patients. So once you see some of the most common complications, you can be ahead. So, for instance, a patient that comes with a GI bleed, that's been vomiting blood, and you know that the patient is telling you, you know what, it was only 3 episodes. This is the first time this has happened, and the patient comes in and has been in the emergency department already for, I don't know, 10 hours, and they have not been vomiting again. So you check the hemoglobin at the beginning of the day, or the ER did it, and then you see that the hemoglobin is only 10. So it's not even that bad. So you can say, okay, so the patient has not been vomiting for more than 15 hours. Um, it seems we have controlled the symptoms. I don't think this patient is gonna need like ICU or anything like that. But what if this patient vomits again? What if this patient has another GI bleed? What if this patient is not going to have hematemesis, but rather is doing melena, and all that blood is going the other end? So should I get should I be ready to treat a bad GI bleed? Yes, the answer is yes. So put those two large large bore IVs in those arms. Make sure you have your type and cross matching of the blood. Be ready, because if the patient goes the wrong direction and these bad things happen, you're ready now to treat it. But if you're not ready, and then your patient crashes in front of you, and you don't even know what type of blood to ask the blood bank to give you, then that's gonna delay care, and the patient may even get more sick. So anticipate those complications and be ready whenever they are happening. Okay. Then this is super important, and I believe I would say this is level 2 of soft skills. Show institutional intelligence. What is this? Every institution has different ways of dealing with problems. What do I mean by this? So, for instance, if you have a patient that has a pleural effusion that needs to be drained, so you need to do a thoracentesis. In some institutions, those thoracenteses are going to be done by the pulmonary critical care fellow. In all institutions, those procedures are going to be done by the procedure team. In other institutions, by the interventional radiologist. I don't know. So in other hospitals, the general surgeon is going to put a chest tube. So what you need to know is who to call and when. So that is institutional intelligence. If you know the person that is going to do this the quickest is going to be the procedure team. That's the team that is going to come the fastest and want to solve my issue, my problem. So I'm going to call the procedure team. That is institutional intelligence. Okay. Or another example in my institution, infectious diseases starts working at 8 a.m. So if you call them at 7, they're gonna be super mad or they're not gonna answer the phone. So I'm like, okay, I cannot call them before 7 because then they're gonna be mad with me, and I have 3 patients that they're seeing because their shift doesn't start until 8. So I need to wait until it's 8:05 so I can make a call. That is institutional intelligence. So look for those clues in a way that you can use the resources to your advantage and you can navigate the healthcare of these patients better. Emotional intelligence, super important. Knowing how to regulate your own feelings, and this goes in all directions of the spectrum of the feelings. Maybe you made a mistake, maybe you forgot to place an order, maybe you didn't call for a consult that was not super urgent, and on the following day they're asking you, hey, you didn't do this, you didn't do that, you didn't do that, and then you are like getting smaller and smaller and smaller and smaller and smaller. You can have an internal conversation with yourself, telling yourself, man, I suck. Yeah, all those doubts that I had, they are true. I am the worst intern. I'm not gonna make it. My seniors are disappointed. My attendings are disappointed, and you're gonna be feeling very bad the rest of the day, and maybe that's gonna carry forward. Or you can have an internal conversation with yourself and telling yourself, "Oh man, I screwed up. Next, this cannot happen again. I have to make sure that this is not happening again." So you paint the picture in a way that you allow yourself to grow from that. So you see, that's gonna help change your own outlook of how things are going in residency. Oh man, I screwed up this time. It's not gonna happen. And then when you have another patient with a similar situation, you already know. And it's like, this time I'm not gonna make this mistake. And boom, you don't do it, and you learn from that. So that is emotional intelligence. So learning how to navigate your feelings and to use whatever input is coming from your day-to-day life in your favor. Now, cultural intelligence, we talked about this already. Uh, Self-awareness, this is another super important soft skill. If you are not self-aware, what is self-awareness? To know and to recognize that when you made a mistake, it is your mistake, and to own up for that mistake. Okay, it's not the same like you made a mistake. That's the same situation that I just described. You forgot to call the consult. Okay, you can say, oh yeah, okay, whatever, it was not even the most important consult for the day, so whatever. You can have that. You can have that attitude, you know. Or you can say like, "Oh, I'm sorry, I forgot. I totally forgot. I was super busy. I'm gonna make sure that I'm gonna use check boxes this time." And then you're using check boxes every day. Pam, 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 pam. You're just doing your check boxes, and this is not happening again. And then by the end of the week, you can show your senior, "Hey, look, I'm doing the check boxes, and it's helping me. I'm not missing things anymore." That's self awareness. Okay. So, and it is very tied to the next point of being humble. Yes, you may know one thing or the other, you may have done a good job one day, but you always have to remain humble. You are not going to grow unless you're humble, because there's always going to be somebody that knows more than you. There's always going to be somebody that has more experience than you. And sometimes it's the people that you expected the less from. So always be humble. You're not going to grow if you're not humble. Okay, so boss battles. Some of the hardest times that you're gonna face are gonna be either mistakes, and we already talked about this, but just recognize that mistakes are not failures. Okay, these are just mistakes, and I have personally seen mistakes from my own attendings. So this happens to everybody, even if you already are out of residency for years. It's a human nature. Okay, it's human nature to make mistakes. Just to So that's why systems are important. So when you made a mistake, somebody else catches it, or when you made a mistake, hopefully it's a small mistake. You forgot to change the dose of the insulin, and instead of going up from 20 to 25, you stayed at 20. Oh man, I made a mistake. It's not the same as, oh, I forgot to start antibiotics in this septic patient. And then you come next morning and the patient is septic shock in the ICU, three pressors, almost dying. So it's a different situation. So pay attention more to the things that can kill your patient, essentially. Okay, difficult people, you're going to deal with difficult people, and sometimes it's not even that one person is difficult. It's just basically your personality and their personality don't match. So it's going to happen. It's human nature. Okay, so stay professional, be emotionally intelligent, uh, keep the patient as your priority number one in your mind, and prioritize that. Okay. um, Tough rotations. There are rotations that are going to be super challenging, and unfortunately, you have to go through them. And just exercise everything we have just talked about: resiliency, being emotionally mature, and knowing that you're gonna get better. So it's a lot. So, and sometimes we definitely need to slow down and, take a break. So don't forget about that. Sleep, food, emotions, all of that is very important. And if you don't take care of yourself, you're gonna end up burning out, and that's super real. It happens a lot. Um, so these are some of the things we have been chatting about. So make sure you sleep, make sure you're actually getting enough sleep. Of course, if you are doing like night shifts and it's difficult for you to switch from days to nights and from the nights to days, maybe you need to take melatonin. Maybe you need to use blackouts in your apartment. Do something to do as everything you need to do to allow you to get that rest. Okay, you're not gonna be able to perform well if you're not well rested. Fueling up important. uh, Even if you're on words or whatever rotation that is demanding, make sure that you, even if you are gonna round until late, make sure you have your energy bar with you or some snacks with you. I mean, if you are hypoglycemic, you're not gonna perform well. So you have to be prepared for all of these instances. I always have one granola bar with me, always. And luckily in my program we never skip lunch. We are like, it's very strict, like, oh no, we have to run maximum until 11:50. So you're always going to have your lunch time, but you may need it. You never know. Emotional load, the emotional burden, that's super real, and we have been talking about this over and over. So um, having good relationship and creating rapport with your co-interns and seniors is also going to help you a lot with this. The more you talk about these things, the more you're going to realize this is happening to everybody, and the more you're going to realize that you're not alone in this fight. Okay, so I cannot stress enough how important it is to have friends in residency. Uh, every program is different and every culture is different, and one of the things that I feel most proud of my program is that the culture is very welcoming. And I'm very happy that anybody will, if you are having a bad day and you want to chat about it, anybody will take a moment of their day and share that down moment with you. So find your allies, your super allies. Let's call it like that. Find them, okay? And also do things, do try. This is gonna be super hard and it's gonna be sound like crazy, but try to continue doing your hobbies. I like movies, and I like to, whenever I can, I watch my movie, even if I have things pending. I mean, it's like I need to do my things, the things that makes me disconnect and enjoy life, and I like to do it, and I think that helps me to be uh, to be able to come back the next day or the next week or whenever, and be sharp and be able to perform, because I'm disconnecting, because I am refreshing my mind. Okay, what is this? Oh, a skill tree. So repetition, we have talked about this over and over again. uh, Presentation skills is something that you need to practice, and you're going to get better and better and better, and make sure whatever your specialty is, there's definitely you're going to find multiple templates online, and your program may even provide that. So make sure you practice. The thing is that you need to practice, and you need to be organized. I think those are the biggest things. Be organized, and um, communicate the information in a logical way. That's going to help the person that is listening to you to get the right information and be able to reach to a good differential and a good treatment plan just by listening to you. Okay, so be mindful whenever you are thinking how you're going to present a patient. You have to have a system, and you have to follow a specific route. Let's call it like that. Clinical reasoning is kind of like we talked about Gestalt. This is something you're going to develop with the reps. Okay. Um, so you're going to get there. Task management. This is another thing we have been talking about: systems, systems, and systems. The more you practice your system, the more you refine your system, you're gonna become more and more efficient. And even I consider myself to be super slow compared to some of my classmates. But there was a time when I was like, oh man, I'm finishing early. Oh wow, and I was alone today. I dealt with 15 patients on my own, and I'm done by 4 p.m. Wow. So that happens, and it's incredible how it happens, because you are not actively thinking about it. You are just doing, 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 and then there comes a point where you are like, oh wow, I have really developed, and that's going to happen to you. And the same thing for codes and difficult conversations is practice, practice, practice. Then feedback. Okay, so feedback is one of the most important parts of residency. It's part of learning, and it's part of teaching. Okay, so you are gonna have to receive a lot of feedback, and you're gonna have to give feedback. All right, so this is important that you keep this in mind, because feedback is how we grow. All right, so first of all, when you're receiving feedback, keep in mind that it's not easy to give feedback, and especially honest and actionable feedback is not easy to do. It's uncomfortable. Sometimes these are uncomfortable conversations. So always be thankful with the person that is giving you feedback. Okay, they are making you a better clinician by giving you feedback. All right, be humble, be self-aware, and be emotionally intelligent. So take it, learn from it, and move on, and try to apply what they are recommending you to do. Okay. Now, sometimes you're not gonna get the feedback just automatically. Sometimes you have to ask for it, and I actually encourage you to always ask for feedback, at least during your intern year. Always ask for feedback when the week is up, is finishing. Always ask for feedback. Whenever you give feedback, you have to be specific. So keep that in mind. Okay, your seniors may ask you for feedback. Your interns, your students may ask you for feedback. The more specific you are, And the more you are able to provide actionable items, what you need to improve on, the better. A feedback that you are saying, "Oh yeah, you did great." Like, okay, what does that mean? Okay, it's like, "Oh no, I like how you ask questions to the patient. You ask the appropriate type of questions. I like how you teach the patient what is going on, what is our plan of care. But I think you can use simpler words because sometimes the patient may get confused if you use very technical words." That's actionable feedback. Okay, and it's practical. So keep all of that in mind. We're almost done. Fellowship aspirations. This is depending on each specialty. There are some fellowships that are very competitive. So the sooner you decide, the better. And how do you decide? Well, it's gonna be a gut feeling. It's gonna be but how can you actually have a gut feeling that is telling you, hey, I do really like this specialty? The only way is to actually have experienced that specialty. So I recommend you to try to seek early clinical exposure in the fields that you are interested. Um, Sometimes it's difficult to get elective time, but if you are really interested in a specialty, I think you should communicate this to your program director and your chief residents so they can kind of help you move things around so you can get that elective time and those specialty, subspecialty exposure that you need. Um, Mentors are super important, and especially for fellowship, because as I said, some fellowships are super competitive. So identify who would be a good mentor, and half of that work is actually knowing who's gonna bat for you. So your seniors may be able to tell you, you know what, this person is somebody that you should talk to. So ask to your seniors, hey, who's interested in doing fellowship? Oh, that person is somebody interested in doing like cardiology. Oh, interesting. So then you talk to that person. Hey, I want to do cardiology. I want to prepare. I want to, do research, whatever. Who do you think I should, which attending should I reach out to so I can get more exposure to research? And they're going to give you that information. Okay. So, but you have to be very intentional. Okay. It's not going to be served in a platter for you. It's not gonna be, oh, look, you want to do cardiology? Come here. No, no, you have to go and find it. Okay. Uh, Also, getting involved in research helps a lot for your application. Consider doing away electives. That's something that you can plan for your PGY-2 year, and you can talk to your leadership about that. And then strategize how to improve your chances. So, be familiar with what how competitive this specialty is. Who of my core residents are applying to that specialty? Ask them, what do I need to do? This is my CV. What do I need to improve? You know, um, ask them if the program has much residents in that particular specialty. Reach out to those persons. That can help you. Okay, so you have to be strategic and intentional. And okay, so this is the practical framework that I was talking about. So divide your year by quarters. So the first 3 months, second 3 months, third and fourth. So on your first 3 months, I recommend you to focus on being the best intern you can be. What does that mean? Essentially, make sure that you know how the hospital works. You are making sure you are checking all your boxes. You are doing all your consults. You get there on time. You make sure that patient care happens. You make sure that your orders are actioned. So you make sure that you close loops on consults. You close loops on communication. That should be your main priority on your first 3 months. Because if you're a good intern, then you can grow into becoming a PGY-2. So second trimester or quarter, I recommend you to focus on knowing how to optimize the hospital resources or your program resources, and so that you can provide the best patient care possible. Know where to find information. Use AI to your advantage. Use your resources, whichever, I don't know, QBank you have, whichever books you have available, up to date, whatever you're using. And also the wellness resources. Some programs provide this, and this is something that you may be able to take advantage of. Then on the third quarter, now at this point, I am recommending you to focus on knowing how to solve the most common issues. Now you know how to use it, how to be a good intern. You know how to use the resources. Now focus on, okay, I'm on my own. Think about it. I'm on my own. How am I gonna solve this problem? Like a GI bleed, an AFib with RVR, like septic shock. You know, so focus on knowing how to solve these issues. That way, now you can build up on everything you have learned before, and you can master the material. And when you reach your fourth quarter of PGY-1, you are feeling more confident, and you are actually becoming more independent. So by the end of your fourth quarter, you should be functioning at a PGY-2 level. So you should be uh, you know, making the decisions, bringing the plan, not waiting for your senior to give you the plan, and so on. Okay. So now, if in this framework we think about step three, uh, I would say in the Q2 and Q3 could be the best time, or even Q4, depending on when your program wants you to take step three. I wouldn't recommend you to do it in Q1. Q1, focus on being a good intern. Focus on understanding how the program works, the hospital works, and everything else. Okay? Now, some closing thoughts before going to your questions. Um, you don't have to be a superhero on day one. You are not expected to be Sir William Osler on day one. Okay? So everybody has the same baseline. So nobody's expecting you to be the best on day one. Okay? Intern year is not about starting powerful, it's about becoming reliable. And that's key. To be a reliable intern is to become a good senior. Okay. And that is part of being a senior. It's somebody reliable. If the team decides that the patient needs X is gonna happen by the end of the day. That's to be reliable. Okay. And that is what you are supposed to become. Be kind to yourself. We have talked about that many, many times. Be kind to yourself. Your internal conversation, your internal dialogue is super important. And I encourage you to exercise a positive dialogue. Whether they show it or no, everyone in your class it's gonna suffer the same imposter syndrome. Everyone. Some will not show it, but everyone is gonna suffer the same. And in every video game there are rivals, right? So I believe the only rival that you have is yourself. And I believe that the best way to grow is to look yourself in the mirror and try to be better than before, than yesterday. You have to be yourself. Oh man, I know that I need to order this random test for a patient with new liver cirrhosis. I'm gonna keep it in mind. So the next time I have a liver cirrhosis, I'm gonna order this test. So beat yourself, not anybody. You don't have to compete with anybody, because in the moment that you start to compare with other people that have different backgrounds, different education, different priorities, different family situations, you are gonna set yourself for failure. Yes, I believe so. So just strive to be a better version of yourself. That's it. Don't forget to recharge and rest. Trust the process. It's a process that works, and thousands, perhaps millions of residents have gone through this, and it has worked. And resilience is a mental muscle that makes you stronger. And the more you use it, the stronger you become. So be resilient. Don't lose hope. You're going to get better. You're going to get there. Thank you. Okay. Let's see. I have some questions here. Most PGY-1s have good attitude during first year, but what happens when you have bad leadership from seniors or attendings? How do you manage that? Oh, that's a great question. So every program has different cultures, as I mentioned. It's difficult because you have to weigh in many things. Oh, I think I don't need to share my screen. Hold on anymore. Okay, so you have to weigh in many things. On one hand, yes, your peace of mind is important. On the other hand, is well, I want to finish residency as well, right? So it's not that easy, and I recommend you to pick your battles. And if you have significant concerns about somebody being malignant or that have bad, attitudes, then escalate it in the right manner. What do I mean by that? Well, follow the right hierarchy. So go first to your chief residents, or you may even have some class representatives, and go to your class representative, then your chief resident. And if you are not seeing a significant result, then you can escalate. You may have a faculty mentor that you can escalate to. And lastly, you can go to your program director. Now, I'm not going to assume anything, but it may happen that your program, leadership is not the best. So you do have somebody else to you can actually reach out to, which is the ACGME. So you can actually file a complaint to the ACGME directly, and ACGME is the regulatory body, and programs are scared of the ACGME. So be aware of that. Um, at the same time, I mentioned you have to weigh in risk and benefits, right? What are the risks? Well, if your concerns are, I don't know, not that important, and you are complaining about everything, you may be seen in a bad light, and that may play against you. Okay, so you have to pick your battles. If, for instance, let me be a little bit more clear. For instance, I don't know, your your schedule changes mid-month. It shouldn't, but it happens. Okay, so if that happens every single month, that's a problem, you know. So you should speak up. Definitely speak up professionally, being emotionally intelligent, but you should speak up. Now, that's not the same as you are working more than 100 hours a week, and your faculty and your attendings are making you stay in the hospital for over hours that you are breaking the 80-hour week rule. That's a completely different story, you know. So you're gonna face some issues that are like um, more significant, and I would encourage you to speak up about those. But maybe not everything needs to be escalated, and always have the perspective that you are going to be, I mean, residency is going to be tough anywhere you go, and residency it's going to be over in a few years. So sometimes you just have to bite the bullet. Unfortunately, bite the bullet. Or you can go ahead and fix it yourself, which is something that I have done, yeah, as well. So find solutions, propose solutions, uh, look for allies, and try to fix it yourself. If the culture is a problem, try to strategize a way that you can change that. Talk to your class. Maybe you have to have meetings with your class, and with your class you can make decisions. Hey, we have to stop this cycle of malignancy, whatever. Whenever we become seniors, we have to stop this. We cannot be like this. And then you become PGY2s, and that cycle is cut. Perhaps there are some things that are still remaining, so you do the same thing over and over again, and you encourage the new PGY ones to also improve, and that's how things improve. So those are just ideas that I have right now, of how I would take care of this. Okay. What happens when the accelerated staff also have unhelpful attitudes? Okay, so yeah, that could happen as well. And usually the institutions have a different processes of how to deal with this. So ask your seniors about it. For instance, in my institution, there are some anonymous reporting that you can do, and an investigation will be launched whenever something like that happens. But I mean, pick your battles. Okay, so that's also something you need to keep in mind. Pick your battles. Are there any AI tools you can recommend? Yes. So AI is something that we still don't know how to use in graduate medical education. And it's a fantastic tool, but also there's a lot that we don't know. So I would suggest you to use AI in a way that will not compromise your growth as a physician. Okay. What happens if one day, like in the pit, there's no internet and nobody has a way of connecting to internet, or you don't have Epic, you know? It's like, oh, what do I do now? So yes, you could train and using all the AI that you want, and maybe that's gonna compromise your development, and I would try to avoid that. So, what AI tools are there? Well, you have my favorite one is Open Evidence. Open Evidence is free for physicians. You probably have at this point of the year an MPI number, and it's free with your MPI number. So it's very useful. You can use it for many things. Now you can even create patients and create patient encounters, and you go into the room. This is more for clinic, for outpatient things, but you go into the room with the patient and you are activate the listening capabilities of Open Evidence. You have to communicate the patient that this is something you're going to do, and your conversation with the patient and the history you're taking, the physical exam you're doing, you can verbalize, oh, I listen that your lungs are clear. Oh, you don't have any murmurs. Oh, your veins in your neck are distended. You have JVD. So, all of that is going to be heard by the AI, by Open Evidence. And then at the end, you tell the patient the plan, what you're going to do, this and that. Click, and your note is done. Uh, you can even change the format and teach Open Evidence how to change that format to make it the way that you like it. And it's gonna be a continuous process. So that's super useful. Some programs may not like you to use Open Evidence in that way. So in my program particularly, there's gonna be a policy change about this. But PGY-3s are the only ones allowed to use Open Evidence or any of these charting AIs to help you chart, because you're supposed to become more efficient. That's one way of using AI. Now, a different way is like, okay, I have a patient that I don't know what the diagnosis is. These are the signs and symptoms, and I'm gonna ask the AI, "Hey, this is what's going on with the patient. What do you think this patient has?" So the AI will tell you, "Oh, this patient seems to be having this and that." You can ask, "Hey, what's the treatment?" That's very dangerous. Very dangerous. Okay, you are not probably not given the full picture or the full context, and you are not doing any of the thinking. Okay, so I highly recommend against that. A different situation is when you have your own differential diagnosis. Hey, I have a patient that has these characteristics. I'm thinking about this differential diagnosis. How can I work this up? Boom, 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 boom. It gives you a list of labs that you should do. And then what I recommend doing, what I also do, I corroborate with either a guideline or with a open, up to date, or I love my pocket. I actually have it here. I still use the pocket. I have it here. I still use it because it's faster sometimes. All the information is there, condensated there, instead of typing the whole thing, you know. But yeah, so always corroborate. But that's a different story. Or, oh, you know what, the example we talked at the beginning, oh, it's a long nodule. Do I need to follow it up in a year? Do I need to pursue a pulmonary consult to do a biopsy? Do I do it by IR? What do I do? So you can actually ask, okay, what is the protocol for evaluating a long nodule in a patient with these risk factors based on guidelines? Boom. And it's going to tell you what to do. Okay. And you use that information to inform you of what you are going to do. Okay. So it's different. Those are different ways of using AI. So be careful. Okay. Use it and ask what is allowed in your program to do. All right, amazing. Thank you, thank you, thank you. Representation, programs, university versus community, how to apply to competitive fellowship. Okay, so yeah, this question is about how to apply to competitive programs coming from a community program. So I think the labels are true. A community program is going to be less likely to match a resident in highly competitive, super academic places. I don't know if you are training in a community program in the middle of, I don't know, Alabama, maybe your chances of getting into Harvard to do interventional cardiology are kind of slim. Um, but that doesn't mean that you're not going to be able to match into cardiology. Okay, and not every university program is the same, and not every community program is the same either. So there are some community programs that are fantastic, fantastic. You have Cook County in Chicago. You have Jacobi in New York. This I'm talking about internal medicine, right? So this is what I know. But you have more like that. So like very strong community programs that can match their applicant, their residents into very competitive fellowships. So I don't think the labels are 100% a limitation. Now, the most important part, I think, is to know what your program has matched before and whether your program has an in-house fellowship or not. So if, for instance, you are a candidate that want to do cardiology, which is one of the most competitive ones, and you are interested in staying in a specific part of the country, then your options are a little more limited. So you may need to do a lot of things to make sure that those programs see you. What do I mean by that? Going to conferences that are local in that area. Whenever you go to national conferences, go and find those program directors. Introduce yourself. Um, Reaching out to see if they have projects that you can collaborate with. reaching out to do away rotations in those places. All of these things help you to improve your chances. So if your program has never matched somebody in a specific specialty, maybe your chances are low. Doesn't mean that it's impossible. There's always a first step for everything. So keep that in mind. Yeah. So don't let those labels limit you. Okay. Super useful insight. Thank you. Oh, thank you, Sharon. Okay, great. Any other questions? No?
Dr. Cuenca, thank you very much for your time and for this amazing presentation. I think everyone had an amazing experience today, and I really enjoy how you created this presentation as a game. It was very fun and also very interesting. Thank you very much for your insights. I think I myself learned a lot that I'm going to apply now as I enter and start my program. Thank you very much for your time. And well, thank you for being here today. Have a
Of
good
course, of course. Thank you. Thank you, guys. Have a good night.